Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Welcome to another edition of the Empowering Plans Podcast. I'm your host for today, Brady, Bizarro, and I'm joined by attorney Andrew Silverio. Say hello, Andrew.
Hello.
Awesome. Well, it's another State of the Union address this year, and so we wanted to talk about that for today's podcast. A lot was said, or really not a lot of words were said, but a lot of policies were talked about, and a lot more were not talked about. So what we thought we'd do for you guys, the listening audience, is to go over what some of the more important things healthcare related that were discussed actually were and what we think is likely to happen this year. Typically in these States of the Union addresses, it lays out a roadmap for the administration for the coming year. And so it's always a good idea to follow along some of the policies that are announced because it's a good indicator of what will happen from a regulatory standpoint, sometimes from a legislative standpoint, although anyone following our webinars or politics in general in the last couple of years knows that not a lot's been happening in Congress, even on some popular issues. But I wanted to start with one of the biggest ones in healthcare that was addressed yesterday, which is prescription drug prices, because these speeches are usually an opportunity for the president to talk about policies that are supported on a bipartisan basis. And there's probably not a bigger one than the policy of allowing Medicare to negotiate drug prices, which we know in our industry would have a huge spillover effect in helping to create a kind of pricing index that could be utilized in the private sector. And so this is a policy that we've been talking about for a couple of years at least now. Former President Trump was in favor of this policy. Both sides of the aisle say that they're in favor of this. I was looking at recent polls just this morning, and 83% of Americans agree that Medicare should be allowed to negotiate drug prices. The president mentioned this again last night in his speech. And he noted that already for the Department of Veterans Affairs, they're allowed to negotiate prices. So he's kind of just saying, why not just expand this? We've covered at length in our previous webinars about the roadblocks to allowing this. And it has a lot to do with lobbying and the power that the pharmaceutical industry has over lawmakers. There, of course, they would say that if you allow negotiation, that it will impact research and development, it'll stifle innovation, it'll lead to higher costs for consumers and less availability of drugs. I think at this point, though, many in our industry and the wider public are beginning to notice that this is not a sustainable argument, that these things will still happen just fine. And so what I'm looking to see is, will there be a version of a paled back prescription drug bill introduced in either chamber? The president's large agenda item, Build Back Better, which contained all these healthcare policies, was killed a couple months ago by his own party. And so now pieces of the legislation are being picked at and potentially revived. And this is one of them. So Andrew, what did you think about the section of the president's speech where he talked about, things like insulin prices, and he pointed out the absurd costs that Americans pay? Is there any hope that you have that we'll see some movement or relief for people in our industry on this topic anytime this year?
Well, hope, absolutely. I have hope. Optimism, I don't know. This isn't really the venue for details. You get little sound bites on certain issues, like we need to lower the price of prescription drugs. Who wouldn't agree with that, right? But how do you actually do it? And we didn't really get any of those details. So, lower the price of drugs, no brainer, right? Let Medicare negotiate the price of drugs. Sure, that's widely supported as well. But what does that really mean? Brady, maybe you can shed some light on this. Medicare, the way it covers drugs versus other services, in a lot of contexts, doesn't Medicare just sort of unilaterally decide what they pay for certain services? Like you see in dialysis, Medicare decides what they pay for dialysis based on location. And then you have a reference that other payers can look to, private plans, reference-based pricing, that sort of thing. How do drugs differ, right? Why do they need to negotiate the price of drugs? And why can't they just say, Medicare pays this amount for insulin and, we can do that because we're the government?
I think that's probably one of the fears that the manufacturing industry has, Andrew, that they'll just set the price. There won't really be a fair negotiation. But if you look at other countries, like I know in the UK, for example, where they pay far less than we do, and their National Health Service has negotiated drug prices. But you're right. Really, what they've said is, look, we're the biggest payer by far. in the country. Here's what we're going to pay, take it or leave it. And so what I would be doing if I were, and perhaps there are, think tanks and policymakers that are focusing on behalf of drug manufacturers, looking down the pike, trying to influence what that negotiation might look like. Because if you asked me, I agree with you that I have hope. And I think eventually this is going to break through and there's going to be movement on this issue. So if I were on the other side of the coin in terms of the negotiating table, I'd be looking for ways to influence the factors that Medicare will consider when setting the price that they'll actually pay. But overall, I think, this is not unexpected. This is unsustainable, the cost of specialty drugs and prescription drugs in general. The president highlighted a sad story about insulin and a 13-year-old boy whose parents are struggling to afford a drug which he needs every day, in which you can get across the border in Canada for less than a quarter of what you pay here in the United States. And many of you have asked us over and over again about, strategies for combating rising drug prices, things like drug importation. They want to know the latest on the administration's position is on that, and on and on and on. And this issue is not going to go away. And like I said, it has 83% support in the public. So eventually, I think that it'll become too much pressure for all the campaign contributions in the world to overcome. So I do have hope on that topic. And we'll be, of course, following anything that comes out of the administration in terms of regulations on that front. Another topic that he referenced that's very, very important for us in our industry is mental health parity. And he only really just said he called for full parity between physical and mental health care. But we know in the industry what that means is it's a reference to the fact that a lot of plans and insurers have been falling short. We've seen a historic enforcement and audit of self-funded plans and their administrators to make sure that benefits are offered in parity. And so, one of the services that we offer now is the NQTL testing service, which is a requirement the federal government has that every plan conducts this testing to make sure that you're offering benefits in parity. So I thought it was interesting the president thought this was an important enough topic to mention in the State of the Union address. There's an epidemic of mental health claims and issues going on in this country. The Surgeon General just put out a report about children, and I believe even up to teenagers and young adults that are struggling with mental health issues. It's really at record levels. So this is another topic that you really need to take seriously as a plan sponsor or as a TPA and make sure that you're in compliance. And I think this is one that's not going away. Any thoughts on that particular issue, Andrew?
Yeah, I mean, it's already clear this year that it's a priority for the DOL doing these audits and looking at mental health parity. So we've been real busy doing the analyses, looking at non-quantitative treatment limitations. That's what NQTL stands for anyone out there who isn't great with acronyms like I'm not. So, that's your limitations that don't jump out at you as obvious parity limits and parity issues, right? You look at a benefit grid, you see 80% benefit for inpatient medical care and a 60% benefit for inpatient mental health care. Obviously, that's a parity issue, right? But we're talking about the non-quantitative stuff that it can be more subtle, stuff like pre-authorization requirements or administrative hurdles that don't jump out as obvious, and even things that don't even look discriminatory on their face that might have the same requirement has a disparate impact on mental health care or substance use disorder care. So the analyses look at actual claims. They look at the plan document, of course, but also how these situations actually play out in the real world. So they're pretty involved. And like I said, the DOL has been focusing on this stuff a lot this year and back into last year as well.
Right. Yeah. And I had one more thing I wanted to bring up that was discussed, and there are a couple others. So look for our webinar. We'll go into more detail here about what we think the implications are. But he did mention an important development with COVID-19, which I'd be remiss not to mention, which is this new testing to treatment policy the administration is going to be rolling out over the next couple of weeks, where essentially anyone could go to a pharmacy, and if they test positive or if they have tested positive for COVID-19, they could get a pill. And the president was referring in particular here to Pfizer's Paxlovid, which is a treatment in the form of a pill for COVID-19. And that pill would be made available for free to people who tested positive for COVID-19. That's kind of all he said on that. So I went and see if I could find more detail online that was released by the administration, and nothing's out just yet. But obviously for plan sponsors, we want to know who's paying for this pill. Did he mean the government would be paying? I'd be shocked. Or did he mean that insurers have to foot the bill like they are in most cases for over-the-counter testing? So we'll be watching that in the coming weeks to see if there's any developments there, because that's a big deal. And great news for Pfizer, who I know are scrambling to produce enough of these pills to make them available to everyone who wants one who tests positive. So that's a big one I'll be watching as well. And the time we have left, let's just mention quickly, Andrew, the things that weren't discussed, because there are some big ones, and I'll just throw out there and let you jump in with yours. But the No Surprises Act wasn't talked about, and nothing about the price transparency rules. In short, nothing that was passed under the previous administration. Surprise, surprise. But I thought a lot more could have been said there. I don't know what you picked up on that regard, if anything.
Yeah, in previous State of the Union addresses, President Trump talked about drug importation. They rolled out an initiative to set up a federal process to approve drug importation programs, right? None of those programs have actually been approved. And the Biden administration actually has made it pretty clear through court filings, actually, that it's not a priority, that they're not really putting any effort or emphasis on that program at all. Need to get too much into detail on it, but essentially a party challenged that program, and in defending the program, the administration basically said that the claim wasn't ripe because none of these programs had actually been approved, and it was unclear when or whether even any ever would be approved. So it's clearly not a priority. Not terribly surprising. Drug importation has been sort of a hot button issue on and off over the last couple of years. It seems to come in waves, but right now it doesn't really look like anything's happening, and it wasn't even mentioned.
Yeah, and I think part of this has to do with, obviously there's a lot going on in the world right now, and so much of the president's speech was focused on foreign policy, but typically we do see more time spent and frankly more words spent on domestic policy agenda items like big ones like healthcare. And we didn't get a ton of that, but I do think the ones that we did get and the ones that we highlighted in this podcast should give you a good sense of where the administration is going to be focusing its efforts in the coming months. And I think you'll see the various agencies will be issuing regulations, flushing out, already existing ones to make clear that they're going to be taking things like mental health parity more seriously. They're going to be trying to reintroduce a bill to allow for some limited, perhaps, version of price negotiation with Medicare. And so, as always, the FIA group will be watching that, and we'll be reporting on any developments and certainly getting ahead of the curve and letting you know how you can best prepare your plan, how you can best prepare as a TPA or a broker in the industry, and what you should be doing to be on top of all that. So on behalf of myself, Andrew Silverio, and our amazing producer, Pat the Man Santos, thanks everyone again for tuning in to another edition of the Empowering Plans podcast, and we'll see you next time. Take care.